Today we're discussing an important piece of healthcare infrastructure, community health centers. You know, I'm a doc. I worked in Louisiana's safety net or charity hospital system for over 25 years. I know how community health centers provide primary care to low-income and uninsured patients, and also provide behavioral health, dental services, and other care essential to those folks, our fellow Americans. And this is a topic we can agree upon. Now, I hate to be a fly in the ointment of what should be a good hearing, but I'm a little bit upset that the majority chose not to work with Republicans in developing the hearing. There's no reason we could not have gone through the basic bipartisan Senate procedure to hold a bipartisan hearing. Republicans support this issue. Now, calling partisan hearings is a prerogative of the chair, but for issues like this, there's no reason our staff should not be working together from square one. And I raise this because last week the chair made a wonderful comment. He said that hearings should not be by themselves a hearing. They should be a gateway to bipartisan legislation. But it's difficult to have a bipartisan legislative agenda if the hearings that serve as a prelude are partisan. We can have fruitful hearings, produce meaningful legislation when the minority is engaged and able to contribute. But in this case, the minority must be included in the planning of the hearing. That said, we look forward to listening to our witnesses and learning more about what we can do to address the needs of patients who depend upon community health centers. In Louisiana, there's over 350 health center sites serving over 400,000 patients per year. Over a third are in rural areas. And rural communities tend to be older and at times to have a greater disease burden with fewer physicians and other healthcare personnel available. These factors make community health centers' work all the more important. Now, this committee must reauthorize the Community Health Center Fund before September the 30th. As ranking member, getting this and other reauthorizations done on time and in a fiscally responsible way is my priority. To do this effectively, we need an understanding of the full picture. The landscape of community health centers has changed significantly since the Affordable Care Act was passed and the mandatory Community Health Center Fund was created. Ms. Favre from the Government Accountability Office will give us color on this from their most recent work from 2019. And here's my chart. GAO's report shows that health centers' revenue more than doubled from 2010 through 2017. Further, the GAO, so here's where we are now, this is where we were. Further, GAO's review raises the question, in fact, points out that community health centers have become less dependent upon grants as revenue from Medicare, Medicaid, and private payers has increased. And so here's Medicaid back then, here's Medicaid now. Much greater growth. Grants have grown too, but you can see that Medicare has gone up, private has gone up. Other, and it's unclear to me if other includes 340B because of it, and Ms. Favre is kind of shaking her head no, and 340B is an incredible source of revenue that I don't even think we know how much there is there. So this is not to say that increased funding for health centers is not needed. That's what we discussed today. But to underscore the fiscal climate we're in, Americans expect and deserve a full and thorough review of how their tax dollars are spent. As Ms. Favre is aware, this week I requested the GAO update its work on sources of funding for community health centers, and I ask unanimous consent to insert that request into the record. Thank you, sir. As policymakers, this information is critical to making informed decisions, especially when speaking about mandatory spending. So, Ms. Favre, I thank you in advance for taking this project on. Lastly, the Community Health Center Fund reauthorization needs to be paid for and HIDE protections maintained. We agree. As a physician, I will say an ounce of prevention is worth a pound of cure. If we improve health on the front end, we avoid costlier care on the back end. The chair and I, we're together on that. However, we know that the Congressional Budget Office must operate within scorekeeping rules. More spending, from their perspective, is more spending. There are a lot of figures that will be used today about health center savings to the overall healthcare system. I've seen $24 billion, $25 billion. Some of these statistics are based upon data from 2006. Now, it's interesting to think about how CBO could account for savings based on prevention, but they haven't in the past, and I don't think any of us think that data from 2006 is the basis for picking amounts now. Health centers do great work, but as we know, in competing priorities, mandatory funding for health centers still needs to be paid for. In closing, I thank our witness panel. I look forward to hearing how health centers are using investment from the federal government to provide essential care, and particularly as we sit down and understand this year's reauthorization of the community health centers, we need your information. With that, I yield.